people to make it happen. These were the two pillars of strength that we had, and we started sketching on a blank canvas. And it is only your trust, some of you who have now taken up this course, and some of your seniors who have taken it over the last decade, that trust gave us confidence year after year that we were on the right track. And today, when there is an ambulance that flies on the road with a siren, and you see that people are getting across ways, when you see the signboards of emergency rooms across all the hospitals changing from the casualty department to emergency department, when you see highway trauma centers being developed, when you see air ambulance being talked about in this country, boys and girls, we've come a long way. And I think the College of Emergency Medicine, the membership training program, and each one of you who's been faculty as a part of this program, who's been a mentor to so many upcoming graduates in emergency, you have played a significant role in this journey, and a big round of applause to each one of you for making this happen. For some of you who are young graduates and are passing out today, I can tell you that from my experience on being in internal medicine, in critical care, and now onto the management side of the role, if there is only one specialty which has immense gratification written all over it, and instant gratification, instant, this doesn't wait for anything to be reimbursed later on, right? You'll see the poorest of the man and the billionaire of the city falling down on your feet and saying, Dr. Saab, jaan bacha lijiye main. There is no other specialty which gives you this instant gratification. And my request to each one of you is, don't desensitize yourself over the years. If you felt as strongly on day one in your emergency room to respond to that patient with the pain or shortness of breath, after 20 years, you should have that same instinct to respond for that symptom, even after 20 years. And therefore, keeping alive that emergency medicine culture in you is extremely important. So what makes it happen is to go to the right place, the right department, work with the right mentors. I would wish all of you the very best, and I do hope that the torch that we lit many years ago, each one of you will feel responsible in holding this torch and continue on this path of spreading the brightness of emergency medicine as a specialty. Take up your career in EM, also look at some subspecialty training, and please, whilst you experiment and go across to UK and other countries, come back to your country and train many more people. All the best. God bless all of you. Thank you.
The second person I'd like to call is Dr. Dhawapalni Alagappan. Dr. Dhawapalni is a senior emergency medicine consultant and the head of emergency at Apollo Hospitals in Chennai. He has worked as a consultant in the UK and is a current examiner for the Royal College of Emergency Medicine. And he has been with us since the beginning. So Dr. Dhawapalni, please.
Dear dignitaries, my colleagues who are all here, and all the others, parents and other proud members who are all assembled here for this occasion, a very warm welcome from Apollo Hospitals. This is indeed a very proud moment, and it's the right time for us to recall how the journey began. Mahesh was talking about the cloudy early days, and thanks to the vision of Chairman Dr. Pratap Reddy and Dr. Hari Prasad, they really could see through all of this, and they had the vision. Vision is an overused, overrated term, but they really had the vision to see the specialty through in India. Had it not been for them, for Dr. Hari Prasad to decide we will invite the college, we will run this course in India, so we wouldn't be having the specialty at all. On a personal note, I'm able to sleep at home, even though it's not every night. Most nights I'm still able to sleep because there are guys who are qualified who can hold my department safe and sound. All that was possible because of what these two visionaries have done in those years. Imran was, it's nice of Imran to have invited me here. 2009 was when I visited Hyderabad Apollo, and I was there for the exam then. And it was such a spectacle. You could see the dean of the college, the educational lead of the college, all of them running around collecting papers, doing such extraordinary feats to get the exam done on time. So the effort, the sincerity, and how they held the exam till date is so wonderful. So we had so much to learn based on what we saw in those days. It was really, really something they took it very seriously, and that was unimaginable. So we had great learnings from all of this. Emergency care is consultant-led. It's not consultant-led. In India, most of the care, be it nephrology, cardiology, whatever it is, they all have the specialists have a halo around their head, and they all deliver the care. The patients come for their names. But in emergency medicine, we are just soldiers. Everybody, whether you are the lead, you are the trainee, it's all the same. And for us to have that culture, there's lots of effort which is percolated down from those who've been practicing EM for a long time. I would also like to recall some serious adversities through which the exams were held. In Chennai, in 2015, we had the massive floods when our airport was looking like part of the Bay of Bengal. So we could only reach the airport by boat. I'm not joking at all. And the college had to cancel the exam the day before. We were Hyderabad, Chennai, and RCEM were all on a con call that morning, and decided tomorrow we'll have it in Hyderabad. We worked together through most of the exams. I've been part of every exam from 2009 till now, be it Hyderabad or in Chennai. So we have been through all of that. So that year was extremely difficult. So all the examiners were shifted to Hyderabad in a day's notice, and Imran had to pull up an exam in just a day. Again, the subsequent year, the then Chief Minister of Tamil Nadu passed away. As we were marking the papers, the papers used to be marked in Chennai, and we lived through that as well. The whole city was like a desert. Nobody was on the street, but the exam did happen, so we could pull all that through. So I'm just recalling some really difficult moments through which all this has been done. So it's a proud moment for all of you, and Apollo and RCEM, their partnership has made it all possible for you and many others. Thank you.
To add a note, this collaboration between us has been creating a lot of doctors. The first batch of doctors for MRC and those who cleared out, there were 3-4 people, and 3 of them remain in India. That includes me and Dr. Venkatesh, who is present here. So there are many people who will stay back here and develop our emergency departments. That's how this specialty develops. So all of you who are here, many of you will stay back in India and you will promote emergency care in different countries, in our country, in different cities and states. And this is how patient care can be improved for emergency patients and trauma victims here in India. So thank you so much, Dr. Apalni and Dr. Venkatesh, Dr. Mahesh Joshi. Now, let us understand what the Emergency Medicine Foundation program is. So I'd like to call one of the experts who has been there with the development of the Emergency Medicine Foundation program. I'd like to call Dr. Dakshinmurthy Vijay Shankar. He is a consultant in emergency medicine and Associate Divisional Director of Northwest Anglia NHS Foundation Trust from Peterborough, UK. Dr. Dakshinmurthy.
everyone see it? Yes. Good, thank you. Thank you, Imran. Very good morning to you all. So we've still got another 35 minutes to go to say good afternoon. So thank you for coming, dear dignitaries. It gives us a very good opportunity for the RCEM team to represent the team to represent for the RCEM and to look at all the smiling faces in spite of this last 2 years being given us during this COVID period in itself. So thank you for coming and trying to be very safe as well. So Imran has asked us to start about the Emergency Medicine Foundation Program. The Royal College of Emergency Medicine is being there for setting standards and also making sure, so setting standards and making sure the high quality care and monitoring standards is being enforced, and making sure the administrating the exams is conducted in a nice and quality base in itself. Thank you. And it's also, the RCEM also provides the expert guidance and advice for policies relating to emergency medicine. It's a single authoritative organization in the UK which provides which promotes and excels in providing excellent quality care for patients. Based upon those RCEM standards in itself, the RCEM wanted to establish much more towards emergency medicine globally. And one of the things we introduced was the Emergency Medicine Foundation Program. The program entails for them to have, it's aimed at doctors purely who have fresh out of the graduation training program and the MBBS in itself, and they've done the internship, and they're not sure what they really want to achieve. Well, they're unclear what specialty they've chosen to, or they want to choose emergency medicine, or they want to do surgery, or medicine in itself, but they want to have more wide variety of experience in emergency medicine. Dr. Joshi has said, it gives you the ultimate pleasure of seeing patients recovering in front of you by providing simple treatments for those patients in itself. They are in front of you. And that gives you the pleasure of giving you the foundation program training. It's a 1-year curriculum, purely focused on the workplace assessments. So people who are sitting in the dais or sitting in front of us who have done the Emergency Medicine Foundation Program will tell you that they have gone through the curriculum and trying to fulfill all the necessary requirements for it. So it's used as a structured training in itself, and also it will expand your emergency medicine knowledge in itself. And it also raises the standards of how your training has evolved and how you provide the treatments to the patients. So we set these objectives. Once we set these objectives in itself, we want to say, okay, what's next? How are we going to develop this? That's where we went into developing the curriculum. So it's split into 3 categories in itself. One is the RCEM, what it's going to do about it. Second one is the training sites, what are they going to do about it? And the third, not lastly, is the most important part, is the trainees. What are they going to do really about it in itself? It's the 3 criteria we set itself. It's a big agenda. We started in about 2017 to start this program with the career objectives in itself and trying to spend where do we need to spend the resources in itself. Then we had a team which looked at purely on the curriculum and how we set up the learning hubs and how we provide the education supervision in itself, and in regards to the virtual webinars and overseas training initiatives, and also having the training sites looking at it. So choosing the training sites is also a difficult part. So how we choose the training sites in itself. We want to have a training sites like Apollo, which is already the more sites we do, like the Apollo Hyderabad, the Bangalore, Mumbai, and Chennai, or the main 4 Apollo sites who host the EMFP trainings. So we, as the RCEM team, has to be satisfied that the sites which looks after the trainee are able to supervise them, encourage the trainees, and also provide the adequate supervision in regards to the workplace. It happens on the workplace. It's not on a lecture base. Also, there is some lecture base itself, but most of the training is delivered on the shop floor. And the trainees' participation is much more vital in it. because it's more trainee-led rather than being the trainer. The trainer will try to push you towards it, but the trainees have to take the encouragement. We had the framework in mind, then we have to introduce the curriculum. The curriculum, when we were going through the curriculum items in itself, there was a huge discussions among the group in itself. We need to have a big curriculum, we need to have the exams, we need to have the OSCE stations, we need to have the written exams and everything else. We wanted to make it very simple. Because it's a trainee-led, and also the trainer delivering the training in itself, we want to be purely focused towards certain elements of the core curriculum, which involve the 18 curriculum items in itself. It involves clinical scenarios, resuscitation scenarios, and each module has some descriptions which they need to satisfy to be successfully doing it. And further 2 optional modules. So every site has taken optional modules like quality improvements or audits or the urology pathway or gynecology pathway itself for pertaining to the individual sites and stuff. What we saw was the trainees are so good in it, they chose all the optional modules as an extra for completing those EMFP programs. They didn't leave a single bit, they just covered everything. When we decided this curriculum itself, we wanted to make sure the trainer who's delivering the training has to be trained. So they already provide the training. We want to make it much more structured. And the trainers were so forthcoming. And we've never seen this forthcoming trainees from the UK perspective to go and introduce this program. And we had the trainer engagement to have to deliver this program was a fantastic thing to do. And they went through the training process and they participated in it. So how would we analyze this as an RCEM team to be satisfied that the trainers are able to deliver it? The RCEM team reviews the educational supervisor portfolios to say they're able to deliver the training